Hey there, I'm Dr. Cozy. Nice to meet you. Can I get you to verify your name and date of birth for me? Perfect. Thank you. So, looking at your paperwork, it says that you had a bit of a tumble in the woods, yeah. Yeah, I can see some pine needles stuck. Don't worry, we'll get you cleaned up, I promise. Before we get started though, I just need to ask you a few questions, if that's okay. Have you had any dizziness or nausea, any vomiting? No. Okay. Any ringing in your ears or loss of consciousness? How about shortness of breath? Okay. So none of those. Okay. Do you know when your last tetanus shot was? I can take a look here. Okay. 3 years ago, so you are up to date. Good. Okay. Well, let me get some gloves on and we'll get right into it, okay? I'm sure you're pretty uncomfortable, yeah. I don't know at this point if you're gonna need stitches. I'm gonna have to take a look and probably remove that bandage. Then we can assess. But don't worry. If in fact you do need stitches, we will get you nice enough. Then you won't feel any of it. First off, just need to check your eyes, okay, with my light. So I'm going to have you keep your eyes open. If you have to blink, it's okay. But I need to see that your pupils are contracting appropriately. I can't really see the other eye because of this bandage. Here. Do you mind if I go in and remove this so I can get a better visual? Okay, I'll be gentle, I promise. But it's currently hanging over your eye as well, so it's making it difficult to get a fair assessment here. So just very gently. It's pretty stuck on. piece of tape up here, we can. About getting the rest of this off. I'm sorry. Okay, you got it. So, we go further. Just gotta make sure that there's no injuries to your brain, okay? So keep your eyes open for me again. Good. Okay. So, taking a look here. Most of these cuts do look superficial. There's one longer one here. But I think we're gonna have to get you cleaned up a bit for me to be able to get a good visual on whether it's deep or superficial. Head wounds tend to bleed a lot, so they can be a little bit deceiving in terms of how severe they are, just because with all that blood it can be hard to find the origin or the cut. And that amount of blood, that volume, can make it look like it's a lot worse than it is. But from what I can see, there's just multiple cuts here. Let's clean you off a bit, okay? I'm going to be as gentle as possible, I promise. A little basin. First, let's get rid of these pine needles that I see here. Let me know if any of this is really painful. We can stop and numb you, okay? See how stuck some of these are before just pulling them off, because I don't want to hurt you. have this little syringe here, right here, and it is full of normal saline. So I'm just going to be squirting it across your forehead to see if I can't loosen up anything else, okay? Should not sting at all, I promise. If it is uncomfortable, let me know though, okay? Okay. So let's position this. Is this okay if I place this right here? Okay. So I don't want this to come out super fast. There we go. Okay. Let's get that. A little better than that. This gone. Okay. So doing okay still? Get your forehead as well. I mean further back on your forehead. Just trying to keep it from dripping into your eyes. have some debris or any debris related that we weren't able to flush out here. I don't see anything. I am going to do a little sweep though with this sterile cotton applicator. And I'm just going to moisten it. Just keep that over here. Okay. You're doing okay. Okay, good. Gonna spray some disinfectant, okay? It doesn't sting at all, I promise. Can you use this to keep it from getting in your eyes? Taking a look at you now, I would say these cuts are definitely superficial. None of them look deep enough to need stitches, but I am going to make sure that we get them nicely dressed so that way we avoid any kind of infection or anything getting in there. Because we don't want this to turn into something else. So I think we can get away with a bandage. Okay. Okay. The first thing I'm going to do is actually grab another pack here. On your eye. Okay. See? Just wipe this off of your eyelid. Okay. Is that a little better? Okay. And then I'm gonna grab some nonstick gloves. It's a little bit big, so we're gonna have to trim it. First, though, I have this here. I just want to take this little light. I'm just gonna make sure that all of the other cuts are superficial and don't need any cleaning. So, yeah, the ointment will protect that cut for right now. fine. So, I'm going to put on some Aquaphor. This isn't painful at all either. It's just going to make sure that the gauze doesn't stick. It's non-stick gauze, but sometimes it can still stick a little bit. So this is just going to protect, okay? Okay. Also helps the skin from becoming dry, which can get in the way of healing. Don't want the skin to be too moist, and we don't want it to be too dry either. These are so hard to unpeel with gloves on. You need a fingernail to get in here. There we go. Okay. So first, for sizing purposes, that's pretty big. Cut it in half. Not getting too much in your eyes or uncomfortable if you move your forehead. Okay. Let's get a little tape. Oh, come on. Don't be like that. Tape is not my friend. put a few band-aids on. Just a couple of these little cuts in the skin, okay? First one. Where did I put the other ones? Last one. Once over just to make sure didn't miss anything. Sorry, I have winter allergies. It's the dryness, so you have to clear my throat a lot. Okay, looks like we got everything covered. So, I did order a head x-ray just to make sure there aren't any injuries we can't see. So, just a few moments, someone will come in here and they're going to transport you up to radiology where they will get some imaging done, and then once we have those results back, I will come back in here, meet you back in here, and we can discuss what we find. pretty sure that these are just some superficial lacerations, but it's best to be thorough and make sure that everything is okay. So, before I step out, do you have any questions for me? Okay. If you need anything, there's a call button right there on the TV remote. Go ahead and push it if you need something. It rings the nurse's station and somebody will come running right in. Okay. Okay. I'll see you in a little bit.